All right, everybody, February, it's National Children's Dental Health Month. So dentists across the country are raising awareness about the importance of good oral health for kids. Joining us today is Dr. Laquia Vinson, a pediatric dentist at Riley Children's Health. Thank you so much, doctor, for coming on.
Thank you for having me.
If you have kids, you know, this is kind of a fascinating topic because there's a lot that we often don't think about. Starting with, what's the difference between a pediatric dentist and a regular?
So a general dentist has completed 4 years of dental school, whereas a pediatric dentist has had additional at least 2 years training.
Okay.
In a residency program.
Very interesting. What you guys do down at Riley, right?
Yes.
Interesting. Okay, so I've got one coming in August. Haven't done this in a while. When is the first time to bring that baby in for a dental checkup?
So within 6 months of the eruption of the first tooth, usually around the first birthday.
Okay, and to prepare us, what can we expect at that appointment?
So that first visit is very educational for the parents. We focus on talking about diet, future growth, current growth, and to see if there's anything unusual in the child's mouth.
Okay, and then how often should my child see the dentist after that?
Every 6 months.
Every six
Every
months.
6 months.
And usually if you're a part of a good dental program, they call you and keep you up on that, right?
Absolutely.
What are some of, especially these days, the common dental issues that you see in our kids?
So one thing that we do see is enamel hypoplasia. And so you'll start to see little areas that are brown or yellow on certain teeth. And what that is when the teeth were forming, they didn't form 100% correctly. So the integrity of the enamel isn't 100% perfect.
Okay.
So that makes the teeth more susceptible to decay. And so we advise the parents, we definitely want to make sure we're drinking lots of water, we're doing our regular, at least 2 times a day brushing, and even we may consider adding some supplemental fluoride.
And so those are all things that cause enamel hypoplasia. Am I saying that right?
Yes, that is correct. But the cause of enamel hypoplasia is we're uncertain, honestly.
But you're seeing more of it.
We're seeing a lot more of it.
All right, a question that always comes to mind is you hear through the grapevine, or maybe it's on social media, excessive pacifier, thumb sucking can be bad for a child's teeth. Is that true? Is it false?
It is true. You can see some developmental changes in the placement of the teeth as well as the structure of the jaw with excessive pacifier or a finger or thumb habit. So we definitely advise parents to try to minimize and decrease the habit as soon as possible.
Yeah, so when would you say, you know, I'm traditionally a fan of what I call the binky. When would you say would be a good time to get rid of it?
There's no hard, fast rule about an exact science, but I always tell parents, as a parent myself, we need to perfect the potty, and then we'll worry about the binky next.
Okay, I got it. That's good advice. All right, what else can we do to protect our child's teeth besides brushing on a regular basis?
Drink lots of water. That's the most simple thing that we can do is drink lots of water.
Okay.
Because every time you put something that's in your mouth that's not water, it causes acid to form. So water helps to increase the buffering capacity in your mouth, and it dilutes all the food products that are there.
Okay. That's interesting. Good advice, and I love that it doesn't cost a thing. One more question. A lot of kids, even some adults, are terrified of going to the dentist. What tips do you have for us for that?
Go by and take a peek. Most dentists will welcome you just to take what we call a happy visit into the practice, just to get familiar, to see what the environment is like, and meet a lot of the staff.
Before the appointment, take a happy visit. Thank you so much, doctor. Those were great. Where can we find you?
We are in the outpatient center at Riley. We are on the 3rd floor.
Okay, awesome. Thank you so much for all that great information.